A brain hemorrhage, also known as intracerebral hemorrhage, is a type of stroke that occurs when a blood vessel ruptures and bleeds into the brain tissue. This can cause damage to the surrounding brain cells, as the bleeding creates pressure within the brain and can interrupt the normal flow of oxygen and nutrients. Brain hemorrhages can be a life-threatening condition and require immediate medical attention. Treatment may include medication to control bleeding and blood pressure, surgery to remove blood clots, and rehabilitation to address any resulting neurological deficits. Symptoms of brain hemorrhage. The symptoms of a brain hemorrhage can vary depending on the location and severity of the bleeding. Symptoms can appear suddenly and may include sudden, severe headache. This is often described as the worst headache of one's life. Nausea and vomiting. These symptoms can occur with or without a headache. Weakness, numbness, or tingling. These symptoms can occur on one side of the body or be more generalized. Loss of coordination. This can include difficulty walking, balancing, or controlling movements. Vision changes. This can include double vision or loss of vision in one or both eyes. Difficulty speaking or understanding speech. This can include slurred speech, difficulty finding words, or confusion. Seizures. These can occur in some cases. Loss of consciousness. This can occur in severe cases. It's important to note that these symptoms can also be indicative of other medical conditions, so it's important to seek medical attention immediately if experiencing any of these symptoms. Causes of brain hemorrhage. There are several possible causes of brain hemorrhage, including high blood pressure. Chronic high blood pressure can cause damage to the blood vessels in the brain, making them more susceptible to rupture and bleeding. Aneurysms. An aneurysm is a weakened area in a blood vessel that can bulge and eventually burst, causing bleeding in the brain. Trauma. A severe blow or injury to the head can cause bleeding in the brain. Blood disorders. Certain blood disorders, such as hemophilia or sickle cell anemia, can increase the risk of bleeding in the brain. Blood thinning medications. Medications that thin the blood, such as aspirin or warfarin, can increase the risk of bleeding in the brain. Arteriovenous malformation, AVM. An AVM is a tangle of abnormal blood vessels that can rupture and bleed into the brain. Cocaine use. Cocaine use can cause a sudden increase in blood pressure, which can lead to bleeding in the brain. Liver disease. Advanced liver disease can interfere with blood clotting and increase the risk of bleeding in the brain. It's important to note that some brain hemorrhages may occur without an identifiable cause. Additionally, some people may have a genetic predisposition to brain hemorrhage or other types of stroke. Treatment of brain hemorrhage. The treatment of a brain hemorrhage depends on the cause, location, and severity of the bleeding. In some cases, emergency medical intervention is necessary. Treatment options may include monitoring and supportive care. If the hemorrhage is small and the patient is stable, the doctor may choose to monitor the patient's condition and provide supportive care. Surgery. In some cases, surgery may be necessary to remove the blood clot or relieve pressure on the brain. The type of surgery used depends on the location and size of the hemorrhage. Medication. Depending on the cause of the hemorrhage, medication may be prescribed to control blood pressure, reduce swelling in the brain, or prevent seizures. Rehabilitation. After the initial treatment, rehabilitation may be necessary to help the patient regain any lost abilities, such as speech or movement. This may include physical therapy, occupational therapy, or speech therapy. Lifestyle changes. In cases where high blood pressure is the cause of the hemorrhage, lifestyle changes such as a healthy diet, exercise, and medication to control blood pressure may be recommended to prevent future hemorrhages. It's important to seek immediate medical attention if experiencing symptoms of a brain hemorrhage, as prompt treatment can help minimize the risk of complications and improve the chances of recovery. Thank you for watching the video. Please subscribe the channel and press the bell button icon for the latest updates. Keep visiting the channel, also share with friends and family.